Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I'm very happy to be able to present Dr. Michael Tyler, who's a urologist and deals in prostate health specifically. I want you to know that this portion of our show is presented by West Boca Medical Center, and I'll give you their phone number as we go along. But Dr. Tyler, you have great credentials, but I'll have to tell you something that touched me. You talk about being a loving husband and a father to incredible young and growing family. I've never seen that in a bio before, so I love you already.
Thank you very much. I appreciate that.
Well, as a physician, a lot of physicians get into science so much they don't really use those words for their family, but you certainly have a very, very prestigious and distinguished career in the medical world with what you're doing, because I see where you specialize in urologic cancers of the prostate, kidney, bladder, and testes. So how did you decide to do all this? I mean, a urologist for me was just you're a urologist, but you really have grown to something bigger, haven't you?
Yeah, so, well, first of all, thanks for having me here. I really appreciate
it's a pleasure,
the time and
Dr.
being able
Tyler.
to speak with you and all those listening out there. But, I kind of knew early on I wanted to be in medicine and the medical field growing up. I always enjoyed going to the doctor's office, and I can't tell you why as a child. I feel like that may be
You're
a little
weird.
bit unusual. But I never had really a bad experience doing that. And as I kind of went along, I kind of looked up to them as something maybe I would be interested in. So as I kind of went along in the maths and sciences, and I kind of chose the medical field as a profession, getting into medical school, you get so many options as far as what to choose. You can really go anywhere. So I kind of found that I was more surgically inclined when we had our anatomy lessons, when we have our first year of medical school. So I knew surgery would be the way to go. And I ran into some very good mentors in that process and kind of circled back on urology, something that I knew nothing about going into it. And few medical students actually do get exposed to urology, but urology is an incredible field. It's cutting edge. We're on really at the forefront of technology and devices, and we have a mixture of office patients. We have a mixture of surgical procedures that we do. So it's really, most people when they think of urology, they think of, like you said, one kind of specific surgical or office kind of thing, but it's very, very expansive and it's very exciting.
So if I were to have you at one of my cure symposiums, which is medical symposiums, I always get people who are on doing cutting edge medicine. And I ask them to bring to the table that we're sitting at all the unique gadgets now that they're using. What would you bring?
So
this is a surprise question. Sorry.
It's very hard to bring
the robot, right?
To a table. But if we think about a theoretical table, I use pretty much mostly in my surgical experience a robotic device. So this is called a Da Vinci surgical system. It's developed by Intuitive Surgical Services. And not just urology, but many medical fields use this in surgical cases. But it's a large instrument that actually lives in the operating room, and we use that instrument. And it's a robot that I control from next to the bedside and perform precise surgeries with that. So I would probably bring a picture of it or a video. I couldn't bring the actual robot because that lives in the operating room, but for sure that would be the device I would love to show you and have you learn about.
Okay, but now there are smaller gadgets that you would use for people, and I'll give you like Medtronics. I know when I had someone, they did all sorts of little gadgets for the heart and for the brain. So you're dealing now, of course, with the bladder and for the internal organs, I guess the below the belt, as we'll say. What other new products would you be interested in?
Yeah, so these smaller objects, something that we gear towards office experience and for patients who see us in the office procedurally. And we're talking about usually, I see a lot of men who deal with urinary issues.
Right.
So a couple of these devices that we do use are for the urinary tract and helping men with the ability to urinate a lot more efficiently. So a lot of new things that have come out recently for urinary health and men's health, and actually as it relates to the prostate, would be a UroLift device or a Resume device. And these are things that have been FDA approved fairly recently within the last 5 to 10 years to aid in the ability to urinate for men.
Yeah, that's very important. And we keep talking about men. Would women want to come to your practice?
Of course, yes. So we see men and women. They may have different paths to get to similar symptoms. So it's up to us urologists to kind of tease those out and understand what's the underlying issue going on. But certainly, as much as we deal with men, we do treat women as well. Now, certain urologists kind of may have a niche in a surgical in a specific sex. So you may have a urologist that really concentrates on female incontinence or urinary issues, and you have those who also kind of cater to males. But certainly, any urologist generally trained should be able to handle both of those issues. And there are a lot of different ways that can go.
Well, since you really have been specializing in cancer, urologic cancers, I'd like to talk about the prostate. That's the worrisome thing for men and, of course, and the women who have men they love. Talk about the prostate.
Especially because they have to sleep with them.
That's true.
A lot of time.
Hopefully. Of course, a lot of men who are snoring now don't get to sleep with the women. This is the silliest thing happening. But anyway, let's really be serious about this because you have taken this as something extremely important for you. Tell us about the whole world of prostate cancer, what the hope for is. Do people still die from prostate cancer? I'm just going to be quiet and let you talk.
Sure. Yeah, thank you. So, when I see a patient, and we'll concentrate on men here, but a lot of times they'll just come with urinary issues, or a primary care physician will refer because we're specialists, and they want us to kind of tackle this one issue. But a lot of times when I speak to my patients, they have a lot of other issues kind of related to that, and a lot of them can be attributed to prostate and prostate health. A lot of times when a man actually does complain of symptoms, it's due to enlargement of the prostate. So this is usually a non-cancerous entity, kind of like it's called benign prostatic hyperplasia. That's a scientific term for it. But basically it just means you have a big prostate, and the likelihood is that as men get up there in age, in their 50s, 60s, and 70s and 80s, the prostate tends to grow. We don't quite understand exactly the reason why this happens, but it happens almost invariably in many, many men. It's actually more unusual to not have a prostate problem than it is to have one. And sometimes it's just not attributed to the prostate because the patient never comes to see us necessarily if their symptoms aren't that bad. But when we deal with these patients with these symptoms, we go through a questionnaire. We do some tests in the office to kind of confirm what the suspicions are. There are a lot of different management options that we can take to combat that. So a lot of things can be either behavioral modifications or maybe trying some medications that have been proven to work in this space. Also, we can go straight to procedures such as the ones I mentioned before if the symptoms are very severe or the medications and behavioral modifications aren't working. So there's certainly a lot of different options, and we really do urge and stress that men are very forthcoming with what they're experiencing on a day-to-day basis so that we can help them better and achieve really a cure for these issues.
I'd like to ask you about, I just want to ask you, so as you're talking about that, the PSA, there's been a lot of discussion. Yes, you need it. No, you don't need the test. What are you feeling about that?
Yeah, and that brings me to the other side of the coin, which is the malignancy or the cancer portion of prostate management is the PSA test. This PSA is it's turned into a very controversial test within the past 5 to 10 years, and I can go a little bit through the history of what that PSA is and what it actually is we're looking for.
Please do.
Yeah, PSA is it stands for prostatic specific antigen, and it's a normal chemical that your body makes for specifically prostate cells. So everyone with a prostate will have some measurable amount of PSA in their bloodstream. Now, this PSA lives in the cells of the prostate. Some of it leaks out into the bloodstream, and that's what we detect in blood work. And this blood work is taken usually on an annual basis to screen for prostate health. So a PSA is not a perfect measure, though, of prostate cancer. That is the goal of that test, is to screen for prostate cancer, similarly how a woman would have a mammogram for breast cancer, or anyone would have a colonoscopy for colon cancer. These are all screening mechanisms to try to detect cancer. So this PSA was developed in that respect, but the PSA is not perfect, and sometimes the PSA may rise for other reasons, such as BPH, so a benignly enlarged prostate, can be elevated due to infection. So if someone has a urinary infection, that may rise the PSA temporarily, or any sort of instrumentation or trauma to the pelvis or the prostate itself. So with all that said, it can kind of muddy the waters as far as using that number as a specific screening tool for prostate cancer. So that's where the controversy exists, because historically we've been using PSAs as a line in the sand, and we use very hard numbers to determine whether or not someone should take that next step for a diagnosis of an actual prostate cancer.
I
and
see.
with that,
thank you. I'm glad you are doing this, because I think there is a lot of confusion.
Mm-hmm. And so we'll see a patient who comes in with some lab results that show a high PSA. Traditionally we use the number of 4, and I'll just say that's the number. So they'll come in, say, with a PSA of 5, and they'll be telling me, I gotta get my prostate checked. My doctor wanted me to come over, and let's see what's going on here. And some may demand to have a biopsy. Some may not want to have a biopsy at all, and then that's completely normal to think that. And we could kind of go through what that PSA actually means. So my job is to make sure that PSA is real. I would like to recheck that PSA, do some more confirmatory tests before we take that next step and do a biopsy. And the biopsy is it's a fairly invasive test that we do in the office, but it's something that we would like to prevent doing unless we really needed to do it. Now, if a PSA is continued to be elevated and there is some suspicion that prostate cancer is there, then we go ahead and do the biopsy. And that would be our best chance at making a definitive diagnosis, confirming that there actually is prostate cancer. The reason why the PSA is controversial is because a biopsy is not a perfect test in and of itself. It's the best test we have to detect prostate cancer, but sometimes that may miss prostate cancer, or sometimes it may detect prostate cancers that really are inconsequential to mortality or the overall life expectancy of any given patient. And that kind of goes to the spectrum of different types of prostate cancers that we may run into. There are types of prostate cancers that are low risk, that will never cause harm to a patient in their lifetime, and there are some prostate cancers that are more aggressive that will require treatment. So it's really our goal as a urologist to tease out those circumstances and apply the best care to the patient we can.
And are there clinical trials that someone maybe has some serious prostate cancer? Are you dealing with any of those?
So there is so much data out there as far as the PSA landscape. We've done a lot of research in urology in general, many trials throughout the country and throughout the world, frankly, that show the benefit of PSA testing in a population base. There are others that may detract from PSA testing, and that's where the controversy exists. But we do know that prostate cancer is a very abundantly found cancer in men. As you get older in age, the more likely it is to develop prostate cancer. But the good news is that that type of prostate cancer is of the low-risk variety, not something that we would necessarily pursue an active treatment strategy, more of a surveillance strategy if we did run into that.
I see. So age does present something. And the interesting thing for me is I was looking at your credentials, and you have certainly dealt with a lot of very important people. I am not familiar with Dr. Timothy Wilson, but you mention him, and what makes him so special?
Yeah, so Dr. Wilson, he was my mentor and continues to be a very good friend of mine. So when you're kind of going through medical training, you start in med school and then you do a residency. A residency is a more intense training in that specific field of medicine that you're doing. So for me, that was urology. And then when I was in urology, I decided that I wanted to specialize in cancer care and minimally invasive surgery and robotic surgery. So I had the opportunity to work with one of really the world's leaders in prostate surgery and prostate management, Dr. Timothy Wilson. He's out in California, in Santa Monica, California, currently practicing. So me, I was a New York guy, and I grew up and was raised in New York City, and I took that opportunity to spend a year in California, which was it was an amazing experience. Definitely wouldn't trade it in for anything. To being out there and learning from really one of the best surgeons who kind of taught me all the tips and tricks and ways to be very efficient and do a spectacular cancer operation using a robotic device.
I'm speaking with Dr. Michael Tyler, and he is a urologist and prostate health. We're at the West Boca Medical Center, and by the way, the West Boca Medical Center is there, in West Boca Raton. And I'm going to give you a phone number that you can use if you want to call West Boca Medical Center. You want to get in touch with Dr. Tyler. The phone number is 833-268-1444. Again, 833-268-1444. Or you can visit their website, which is West Boca Center, West Boca, MEDCTR.com. West Boca, MEDCTR.com. I do highly recommend, if you're having any urologic problems, it's been a pleasure talking with Dr. Tyler. He is not only sounds brilliant, but he's very articulate. That's one thing that I've found as a radio talk show host, Dr. Tyler, that I've personally met many, many physicians, but there's about a 50% of these people who can really talk the way you do. So did you take classes to speak so well?
No, thank you for that. I appreciate the compliment, but no.
It's a natural, right?
I guess it's just the experience. Me being confident and knowing what I'm speaking about. I guess helps with that greatly. And I have these conversations so often with my patients on a day-to-day basis. I'll maybe I see about 15 to 30 patients in a given day.
Really?
And, we're having these conversations over and over again. But what kind of gets me through it, it's not a monotony, and I wouldn't want you to think it would be that way. It's actually when I have these conversations, I'm able to kind of educate patients and kind of give them hope and the ability to understand that they're going to be able to take control of their issues, and I help them through that. So that kind of gets me through it, and I get to see their reactions when we do have our consultations.
And do they bring, if they're married or they have significant others, do they include them in these conversations?
Of course.
I hope so.
It's funny. It's whenever there is a significant other in the room, a lot of times I'm speaking to them more than I am to the patient themselves. So I find that relationship extremely vital in creating a treatment strategy and someone who can really be their advocate and look out for them and speak for them, because sometimes men, or because we deal with a delicate portion of the body. This is the urinary tract, the genital tract. It can be embarrassing somewhat for patients, and
yes.
But if you have someone in your corner who's really speaking out for you, who can really help get across the points that you're trying to make, it is extremely, extremely helpful. So I do encourage people to bring in their family members. I think we can get a lot more done in a specific session than we can if you're otherwise alone.
Yes, and besides significant others, I do believe that the boomer adult children should accompany their elder parents, especially the elder gentlemen, because there are decisions that have to be made, and they should be in on all your conversations.
100%. Can't agree more.
Yeah. So, Dr. Tyler, what do you think? Now you have the robot, and that's a Da Vinci robot, and that's great. What's the future? What's 10 years from now?
So 10 years from now in urology, and I think medicine in general, especially cancer management, there's a lot going on with genetics. Genetics is probably the hottest field within cancer management, diagnosis, treatment, gene therapy, gene panels, and diagnosis. So, I kind of envision myself, I'm very good at what I do. I see a lot of patients. I do a lot of cancer surgeries, but maybe not in 10 years, but certainly at some point down the road, I don't know that I'm going to have a role, in surgery. And I think when we look back on what we've been doing here, believing that what we're doing is cutting edge now, they're going to kind of laugh at us, because I feel that with genetics and understanding the underlying mechanisms of these disease processes that we encounter, we're going to be able to change things and treat things at a much earlier point in time, where even the concept of doing a surgery may be antiquated. So I think it's going to take baby steps to get there. Can't tell you how long that's going to take, but in 10 years, I think we're going to know a lot more about what's the actual underlying cause of these issues, so that we can attack them sooner.
So you're talking about preventive.
More preventative, and there's definitely been a gear towards that as far as where we're kind of applying research money and how medicine is going in the future. I think we're trying to be more proactive than reactive with these things, because we know it's clear that being proactive with health, screening, early treatments, and just being, staying healthy at an earlier time prevents these things from happening and leads to, more cost savings as far as medicine. There's a lot of controversy about how much we're spending in medicine in general in our country, but I think a lot of that can be brought down, and we can be a lot healthier and live a lot longer and more fulfilling lives with earlier preventative care and management.
That's excellent. And have you gotten into stem cells at all? Will that be part of the gene therapy?
Yeah, so stem cells are used in certain circumstances. There's a lot of research into that, specifically with cancer of the urinary tract. There aren't too many things that we do that have been proven to be helped by stem cells. But with urology, we do stem cell work. Actually, one of my partners, Dr. Michael Zahalski, so I'm part of a private practice urology group here in West Boca area, northern Broward County.
What is the name of that private practice? And
it's called Urology. It's founded by Dr. Michael Zahalski. He's founded the practice about 14 years ago, and I joined his practice about 2 years ago.
How do you spell that?
Spell Z Urology or Z Zahalski.
I see. Okay, so go ahead. Continue. So he's been into. Okay, go ahead.
Yeah, so he's been using some stem cells and some in more relation to sexual medicine, sexual and men's health, and he's been kind of very active in that space. So it's very exciting, overall. It brings a kind of a flair to our practice that we can offer patients that isn't, offered in a lot of places. So we find that very exciting.
Right, and so we have less than 5 minutes, but I wanted to get into what we commonly know as ED, or erectile dysfunction. So are you saying that that's possible, that you'll be able to do something about that before it really gets serious?
Yeah, and I think that kind of harkens back to the preventative aspect of management, because erectile dysfunction is a very common thing that men go through a lot of times, even in their early ages, earlier than they expected to. We'll just say that. So we have commonly men in their 40s, 50s, and 60s as you go up in age, where it affects them, and why it kind of goes back to preventative care is erectile dysfunction is really an endpoint. It's a symptom, not a disease process of itself. So what that means is there are factors that contribute to someone developing erectile dysfunction, primarily cardiovascular health, and one of the main proponents is diabetes. So sugar control, healthy eating, a good diet, and an active lifestyle will be the number one things you can do to prevent the development of erectile dysfunction. So once erectile dysfunction occurs, not that it's too late. There are certainly options that we have to fix it, but you're not really getting to the crux of the matter, and that is real good control of blood pressure, cardiovascular health, and diabetes. So we do stress that a lot when we first have someone. But if it does occur, there are options that you can do specifically for that to treat it. But our goal is always to stress the underlying cause.
Yes, that's wonderful. That's what, we should be worrying about, not all the medication, but how do we prevent it? And that's preventative health and no smoking and, not a lot of alcohol and a lot of the things that we know can be the culprit.
Agreed.
Well,
100%.
it's been terrific, Dr. Michael Tyler. And let me just do this again. I want to give more information about West Boca Medical Center because they're sponsoring this show. And you can call them for more information at 833-268-1444. That's 833-268-1444, or go to their website, which is westbocamedctr.com. My guest has been Michael Tyler, who is a wonderful, wonderful urologist working, though, on cutting-edge information, and he specializes in the prostate cancer as well as other cancers, and uses the robot. That's a Da Vinci robot. And I'm so happy that you took the time this morning, and now you have to go be with your young and growing family. How old are they?
My daughter is 4 years old, and my son, he's soon to be 2 years old.
Oh, so, well, you are. You're lovely.
Very exciting time.
Thank you.
Adorable.
Yep. Well, I'm going to certainly call you. Maybe we can work on some other things together.
Yeah, that'd be great.
Thank you. Yeah, you're terrific, Dr. Kyler. Yes. Thanks for being on with us.
Okay.
Goodbye.